Hi, I'm Professor Mehmet Engin. Today I'm going to talk about thermomammography simulator for breast pathology research. This seminar is based on the original research paper. Now, this is outline of the seminar. Firstly, introduction, methods, that including subtitles, mathematical background, system development, comparison with patient thermal image, results and discussions, and conclusions. Now, introduction. Breast cancer is an important concern worldwide because how high of it is high incidence. It is common type of cancer both in developed and developing countries. The option of treatment it led health professionals to search tools for detection of cancer in early stages. Mammography is one of the most widely used techniques because it has a good results and general population. However, it has important limitations in sensitivity and specificity. For example, limited diagnosis of women with dense breast, especially young women. For this reason, new diagnostic techniques for breast cancer detection have been developed and improved in order to increase patient life expectancy. These techniques focus on early detection of tumors with smaller dimensions providing a better prognosis. One of them is the infrared thermography, namely thermal imaging. That is a procedure used to record body thermal patterns using an infrared or IR camera. The color segmentation of the infrared thermal images is used for detecting tumors region by different temperatures patterns associated with angiogenesis, inflammations, and blood supply increase. Recent study recognized that infrared thermography increases the possibility of early breast cancer detection and analyze the technique performance using specific indoor controlled environmental circumstances. Thermography is less uncomfortable for the patients because it is not imply direct contact, radiation or compressions. It is useful for women of all ages and different conditions like pregnancy, breastfeeding, implants, dense or fibrocystic breast, and pre or post-menopause. Even if women are under a hormonal replacement treatment could be candidates to use thermography for pathology detection. It is believed that thermography should be most frequently used for pathology detection because thermal patterns could be easily integrated and analyzed by a computer while mammography in general is linked to the radiologist's interpretation and is more probable to yield false positive or negatives. In this study, it is proposed the design and construction of an programmable thorax model to promote the use and confidence of healthcare professionals on infrared thermography as a pre-diagnosis tool. This simulator device could be used in training for thermography operators. The aim is to display a simulation of normal and abnormal thermal morphologies, facilitating thermographic analysis for early breast pathology detection. Simulation of breast tissue have already been reported for technical imaging applications. Using computational simulations of breast models, a difference of temperature distribution is highlighted depending on the size, depth, and metabolic rate of the tumor. These breast tissue phantom were reported using static models, also dynamic physical models that could simulate the thermal pattern according to parameters of real thermal images from patients. This model will be a phantom of woman's thorax from ectomorph complexation with electrical actuator within hydrogen. Therefore, it is possible to simulate thermal breast pathologies by integrating a thermovisual control system in the electrical actuator inside the medium with physical features comparable with mammary gland characteristics. Now, methods. First one, mathematical background. Peirce's equation was used in order to obtain a temperature distribution model from a tumor in a mammary gland. This equation describes the distribution of the tissue temperature as a function of its blood perfusion and metabolic rate. This study used mammary tissue parameters for tumor simulations. A head source was added with tumor tissue parameters. Equation was solved by the element finite method EFM in COMSOL multiphysics and was fixed with average parameters of mammary gland reported elsewhere. In this model, the following parameters are used: tissue density, heat capacity, thermal conductivity, tissue temperature, blood density, blood heat capacity, blood perfusion, blood temperature, and metabolic rate. The simulation was based on models involving two different tumor sizes of 1 and 2 centimeter in diameter, with both with 5 centimeter of depth and three different tumor metabolic rates, such as 29,000 and 45,000 and 80,000 watt per cubic meter. For the model's geometry, hemisphere with diameter of 18 centimeter was used. The average breast size used in explained as literature. This configuration is shown in figure 1. The boundary condition of the system was the heat exchange by the concave part of the systems, while initial conditions were set temperature equals to 309 Kelvin degrees. Now, programmable thorax development. Experimental platform given in figure 2. This is consistent temperature measurements through the thermal camera, filler E40. The actuator sent information to computer LabVIEW-based virtual instrument given in figure 3. This virtual instrument generates a control signal and sends it to the driver through the data acquisition device. Then, the driver energizes the electrical actuator to set the local surface temperature on the thorax. Now, programmable thorax construction. The physical model was made from fiberglass structures using sculpture of ectomorph complexation as a mold. The structure was then covered with thin layer of silicon, approximately 2 mm of thickness, simulating the epidermis of the breast as shown in figure 4. The hydrogen of polyvinyl alcohol, or PVA, polymerized with sodium borate, was poured into area corresponding to mammary tissue, simulating mammary fat pad. Thermal actuators were included inside the hydrogel to generate temperature gradients when they are energized for breast thermal abnormality simulations. Now, design and construction of transducer. Electrical actuators are essential elements for physical simulation of breast injuries. The actuator design requires similar features from the tumor masses, avoid shape and size between 6 to 12 millimeter. Electrical resistors were used to produce heat radiation. To obtain or sense temperature values generated by resistors, LM35 temperature sensors were used. Thermal performance of the hydrogel and silicon blend representing human skin was experimentally analyzed. The actuators corresponding to tumor size tissue were placed 3 centimeters deep in the center of upper quadrants of both breasts because this is statistically the most common area of breast pathologies. Once the actuator inside the hydrogel were supplied with the energy, then produced heat, and for heat production, thermal images were taken to analyze the temperature response. These results, given in Figure 5, their thermal spots associated the heat release and the temperature gradient produced by the actuator with an increase from 24.5 Celsius of degrees to 28 Celsius of degrees were perceived. The hydrogel kept its consistency and mechanical properties, such as memory tissue equivalent. Now, comparison with patient thermal image. A thermal image of patient was chosen. This patient is part of the study group of ages ranging from 40 to 45 with infiltrating ductal carcinoma. This thermal image was analyzed using Fuller tool software. The thermal spots was located and minimum, maximum, and average temperatures were observed. This process was repeated for the thorax thermal image. The temperature gradient between the highest temperature within the thermal spot and temperature in the adjacent thermal spot area was determined. Now, results and discussion. By analyzing the affected zone in the thermal images, as shown in Figure 6 from the thorax simulator and patients, it is observed that the thorax simulator was capable to control the surface temperature around 28 degrees of Celsius, and as consequence, as increase of 2.2 degrees of Celsius from the adjacent tissue, whereas in the patient image, the temperature differences was 1.9 degrees of Celsius, providing an error of approximately 0.3 degrees of Celsius. These variations was ascribed to different shape and size of the thermal spot of thorax simulator and patient as shown in Figure 7. From the mathematical model of thermal distribution in one human breast, it is highlighted that tumors with 1 centimeter of diameter located 5 centimeter deep are thermally visible. Furthermore, as in previous studies, the higher the metabolic rate and the bigger the tumors, the greater the temperature difference between healthy and tumor tissue, producing a larger thermal spot. According to information from mammary gland simulators for imaging applications, there is no specific simulator for thermography yet. There are simulators with thermal properties, but they are used to thermal acoustic imaging, which are not based on the same operating principle as thermography. Also, the thermal properties of those models are focused on the type of dielectric material used and not on the control algorithm. It is important to notice that, so far, there is no simulator with features comparable to ones presented in this article. On the other hand, control temperature varies in specific range, namely operation range, because of the mathematical structure of control and tuning parameters. These variations could be eliminated by adding an external cooling system to maintain the set temperature on the surface reflected by the actuator. Comparison of thermal images between the thorax simulator and patient, as shown in Figure 6 and Figure 7 respectively, using the mathematical model showed that thermal images resembled tumors of 2 centimeters of diameters and at a 5 centimeters depth with metabolic rate approximately 80,000 watt per cubic meter. And the temperature difference between tumor and healthy tissue was also found around 2 degrees of Celsius. This doesn't mean that both patient and simulation thermal images have the same component, since the temperature gradient display is not only a function of tumor metabolic rate, but also the size of the tumor. Contrary to the patient thermal image, the thorax simulator didn't show the temperature gradients corresponding to warmer zones located on skin folds, namely under mammary gland or armpit. Also, as shown in Table 3, temperatures simulated in the thorax were not equal to those of the patient. This was because the operating range of the thorax was from 24 degrees of Celsius to 28 degrees of Celsius. To equilibrate thorax temperatures with human ones, it is proposed to homologate the local temperature observed by the thermal camera from the virtual instrument in lab view. This is accomplished by adding these measurements to a scale factor about 8.7 degrees of Celsius, so that the temperatures observed in the programmable thorax through the virtual instruments correspond to human body temperatures. Conclusions. Thermal imaging was proved to be effective complementary technique for detecting breast pathologies, helping cancer diagnosis because of its sensitivity, specificity, comfort, and low cost. But medical training for image interpretation is based on the clinical case studies and analysis what require a great amount of time and resources. In consequences, the proposed simulation device or simulator to allow health professionals to become familiar with the imaging process and thermographic data interpretation. These devices simulated two thermal patterns, a healthy breast and a breast with pathology. Results were compared with image from patient. The hydrogel and silicon blend thermal performance was similar to human skin, and the operational range of the temperatures was between 24 and 28 degrees of Celsius. Mathematical procedures could be used to adjust the operational temperatures so as to correspond to human body temperatures. From the mathematical model of thermal distribution, it is obtained that tumors with 1 centimeter of diameter located 5 centimeters deep are thermally visible. In conclusions, Thermal images obtained by the simulator achieved to show tumor tissue at specific metabolic rates. The model of the simulator is based on algorithm, and the physical thorax is dynamic system. For this reason, our thorax simulator is a promising tool for training health professionals in important issues of early detection of breast pathologies. Further simulator proposals should consider also the size of tumors in the algorithms. Thank you. See you again. Bye.